All right, so I continue the article from the New York Times. We need concerted international action to stem this recent novel outbreak, said Greg Gonzalez, an epidemiologist at Yale University who served on the WHO's Mpox committee in 2022. The outbreak that year stayed mostly within tight sexual networks among gay and bisexual men. A combination of behavioral changes and vaccination tamped down the spread. In the United States, for example, the toll dropped to about 1,700 cases last year from more than 30,000 in 2022. The version of Mpox that has been circulating in Congo has always been more virulent and currently has a death rate of about 3%, compared with 0.2% in the 2022 outbreak. The infection can produce fever, respiratory symptoms, muscle aches, and swollen lymph nodes, as well as a rash of the hands, feet, chest, mouth, or genitals. Until recently, it spread mainly through consumption of contaminated meat or close contact with infected animals and people. Most of the deaths have been in children who in this region of Africa are already beset by malnutrition and infectious diseases like cholera, measles, and polio. Should the outbreak spread globally, children in developed countries are likely to be less vulnerable to severe illness, experts have said. Last year, for the first time, scientists discovered sexual transmission of this version of monkeypox, with cases split about equally among young men and women. According to genetic analysis, sometime around September, the virus gained mutations that enabled it to spread more readily among people. It has done so partly through heterosexual prostitution. This viral type has surfaced outside Africa. Overall, there have been more than 17,500 presumed and confirmed monkeypox cases in 13 countries, according to Africa CDC. Most of the cases and deaths have occurred in Congo. Given the rapid spread, the declaration of a global health emergency was justified, said Anne Rimian, an epidemiologist at the University of California, Los Angeles, who served on the 2020 monkeypox panel. I think we learned a great deal about the speed with which this virus can spread, she said. Amid rising numbers, Congo has approved 2 monkeypox vaccines, a Japanese product called LC16 and Jynneos. I could be saying that wrong. The vaccine made by the Bavarian Nordic that was used in 2022 in the United States and Europe. But Congo has yet to institute an immunization plan. Already we can tell that there are some kind of disparities here in terms of access to the vaccine. So I continue with the story. On August 9th, the WHO, the World Health Organization, invited vaccine manufacturers to apply for an emergency use listing, a prerequisite for international groups such as Gavi, a global vaccine alliance, to purchase and distribute the shots in low-income nations. Bavarian Nordic has donated 15,000 doses of Jynneos to be distributed in African countries, but this is a tiny fraction of the 10 million doses needed to control the outbreak, according to Africa CDC. The challenge is that these vaccines are not sufficient. Even if countries try to protect only the people at highest risk, said Dr. Dimi Ogoina, a Nigerian scientist and chair of the WHO's Mpox Emergency Committee. L16 was used in Japanese children in the 1970s. Clinical trials funded by the Coalition for Epidemic Preparedness Innovations are now evaluating whether Jynneos can protect children and people who have already been exposed to the virus, Dr. Lurie said. The organization is also supporting the development of a new mRNA vaccine made by BioNTech that would protect against Mpox and related viruses such as smallpox. This outbreak has been smoldering for quite a long time, and we continually have missed opportunities to shut it down. Dr. Lori said, I'm really glad that everybody is now paying attention and focusing their efforts on this. Right, and so this article was from the New York Times, written by Apoorva Mandavilli. Apoorva Mandavilli is a reporter focused on science and global health. She was a part of the team that won the 2021 Pulitzer Prize for Public Service for coverage of the pandemic. All right, so from this article, a couple of things pop up for me. Specifically, we can see, for example, some of the similarities between HIV and monkeypox. Both these diseases are highly stigmatized, right? And it's largely due to the mode of transmission, right? We can see from this article that they are referring to sexual networks as one of the reasons why the disease is spread. And you can also see from this article that we are talking about health disparities. We're talking about health inequalities. We're talking about unequal access to vaccines, right? Specifically talking about the developing and the developed world context. We're also speaking to the underserved groups. I think you heard there where they said heterosexually transmitted through prostitution, right? And you can already see the differences, the anomalies between monkeypox in the United States and monkeypox in the developing world context, where in the US, it was primarily groups, gay and bisexual men. And in the Congo, it looks like the populations that are unduly affected are women and children, right? So that is just to show you some of the, what we call the social determinants of health, such as gender, race, sexual orientation, geographical location, and how these social determinants of health can perpetuate or influence the spread of disease, specifically in specific populations, right? I just want to see if I missed anything. But yeah, so when we look at the outbreak in 2022, the outbreak that year stayed mostly within tight sexual networks, and specifically among gay and bisexual men. And how was the US able to drop these numbers down? It was through a combination of behavioral changes and vaccination tamped down the spread, right? And as I said, some of the signs and symptoms of the disease are you can get a fever, you can get respiratory symptoms, muscle aches, and swollen lymph nodes, as well as a rash on the hands, feet, chest, mouth, or genitals, right? And the thing with this outbreak now is that until recently, it was mainly spread through consumption of contaminated meat or close contact with infected animals and people. But most of the deaths now have been in children who, in this region of Africa, are already beset by malnutrition and infectious diseases like cholera, measles, and polio. And I think a big telling disparity, or something that you can easily see that is going to be unduly affecting the children in the developing world context, is this particular sentence, which says, and I directly quoted from the New York Times, should the outbreak spread globally, children in developed countries are likely to be less vulnerable to severe illness, experts have said, right? And why will the children in developed countries such as the United States be less vulnerable? That's because unlike the children in the Democratic Republic of Congo or other countries in Africa, the children there are already facing cases of malnutrition, already facing cases of infectious diseases like cholera, measles, and polio. So monkeypox is just going to be another problem that needs to be addressed in the context of all of that which is happening. All right, so we will continue to analyze and review articles specifically so I can show you what social determinants of health are and how they are making our communities unhealthy. I hope you're having a lovely day, and most importantly, I hope you're having a healthier day today. Bye.